Please welcome Mary Gar, President of Family Service San Antonio. Her hand.
Good morning, everyone. You can see we're having fun already. And thank you all so much for being here. I know we still have more folks coming in. I think we had a sold-out crowd originally on registration. And it's like we're back in church or something. Nobody wants to sit up front. I promise we've got awesome speakers who would love to be up close and personal with you here. As Bob said, I'm Mary Gar. I have the privilege of being the president and CEO here at Family Service. For those of you who are here in San Antonio, we are a 123-year-old, deeply rooted organization that works to address the very topic that our panelists are going to be discussing this morning. It's all about social determinants of health and those underlying root cause challenges and barriers lives that affect their ability really to be happy, healthy, and successful, like potential, health span, lifespan, opportunities to have access to all sorts of things that so many people take for granted, often tied to institutional challenges out there that we need to continue to identify and work through. How many of you, is this your first time coming to our forum? This is our third year doing it. So for a number of you, it's your first time. Thank you. And how many of you are repeats now coming back? Thank you. We're glad that you're back because that shows you enjoyed what we had last year. We've had amazing guest speakers and panelists the last 2 years. We promise you another strong team this year. And we're very intentional about this work. As you know, when we talk about social determinants of health, we look at 5 different domains. One is the economic stability challenge in people's lives, whether it's food insecurity or housing instability, ongoing poverty, again, mostly intergenerational here, but not always. People can easily fall off that cliff. It could be one medical bill or one tuition bill or something where life has happened, a layoff at work, etc. So the second pillar is that education pillar, which starts with early childhood education and that importance there, because we know the value of children being prepared for kindergarten. And the research shows that if children are prepared for kindergarten, they're more likely to reading at 3rd grade level in 3rd grade. And from kindergarten to 3rd grade, we're learning to read. From 3rd grade on, we are reading to learn. And if we've missed that foundation, it is much harder to keep up because everybody's moving forward, teachers are stressed, especially in our world today, and a child's likely to fall behind or act out, drop out, etc. So that access to education, and then ensuring the supports from K through 12 learning so they can prepare then for adult learning, because we know learning doesn't stop when you finish school. It continues as lifelong learning, whether it's college, career, trades, military, etc. That third pillar, access to high-quality health and health care. It's not just physical health and mental health, but it's also health literacy, nutritional literacy. What does it mean to be healthy? Do you have access to health supports? Do you have access to affordable food, which ties into strong neighborhood and built environment? Are you living in a safe home with all the support you need there? Are you living in a safe neighborhood with that infrastructure? Which also means access to transportation, access to grocery stores that you can afford, access to healthcare, banking that gives you capital credit, safe checking opportunities, etc. And then do you know your first responders, and more importantly, do they know you? Do you have a trusting relationship? And then that 5th category of social and community context or engagement, which I think about is, do you feel comfortable asking for help and resources when you or your family needs it? Are you afraid to do so? Are you embarrassed to do so? Do you not know where to go, or is it not nearby? And then on the flip side of that, do you feel that you are a valuable contributing member of your own communities where you have purpose and value? Or do you feel isolated and alone, which we know we saw during the pandemic with older adults home alone, but also our youth, where we're still seeing effects today coming out of the pandemic in our schools, in our military, in our colleges, in our work environments, where folks had that loss of connection for a couple of years here and are trying to rebuild. Those are the framework pieces for a strong social determinants of health. We can't do it alone. We have to work across sectors. We tend to look at nonprofits to, oh, go give it to a nonprofit, they'll fix it, but let's not give them the resources to do so. We can't do that. We're out there doing great work, but we do it with partners and we do it with support and funding. So that is a key piece when we know there aren't enough resources out there. But it's also specifically the educational sector. It's the healthcare sector, but they can't do it alone. We can't expect our doctors and nurses to quote unquote fix our health when we haven't had access to have a strong healthy lifestyle or understanding and take away all those stresses to begin with. And then also bringing in our government aspects, because where do the policies and the laws and the regulations come from? It comes out of our government and our legislators, our lawmakers, that put in place the very opportunities or barriers on people being able to institutionally access and participate in society here in a constructive way. And then the business sector as well, because you want an employer that gives you a safe environment in which to work, that provides you a decent pay with benefits, because in our world today, most of our retirement planning is tied to employer-based retirement plans, unless you have a lot of savings on your own. Most of our access to health care is tied to employer-based insurance, and we need that health insurance as well to be able to access health care for most people. So we need all these sectors working together, which is why you're in this room. And we deliberately have amazing speakers and experts from different parts of Texas, and then all the way from Connecticut. She's enjoying not being in snow today, because they also know that what we're doing isn't just a San Antonio problem. What we are facing is something that's going on across our country today. We see it a lot here in Texas, San Antonio, and South Texas in particular, because we are a beautiful border state with deep-rooted history and cultural and family and work ties, all across, our borders here in Southwest Texas. But at the same time, we've got similar challenges that you're going to hear about, but similar identification of needs and opportunities and strengths and collaboration. We are stronger together. We are better as one voice when we know what's going on. We can learn from each other rather than being isolated in separate towers here. So you're here to learn and grow. We hope you make more connections today and learn from this, and feel free to ask plenty of questions at the end and afterwards, because we want you to go home and go back to work saying, what can I do next to improve my community, to help my families, to help the children that we all work so hard to serve each and every day here in San Antonio. So thank you all for being here. I'm going to turn it back over to Dr. Bob Sanborn, who is the CEO of Children at Risk, which is a wonderful statewide policy advocacy connecting group that does so much work, and you're going to hear about the data that applies to San Antonio and Texas, and they work hard to collaborate with us and so many others around the state. Thank you, Bob.
Thank you, Mary, very much. Big hand for Mary. So I've been at Children at Risk for over 20 years now, and so going all over the state. I live in Houston, but going all over the state, visiting with nonprofits. One of the finer nonprofits is Family Service here in San Antonio. And Mary has such a great team, so thank you, Mary, for hosting us here today. And a couple of years ago, it was before the pandemic, I decided we had a big national conference of child advocacy groups from all over the United States. And they wanted to come to Texas. They said, Bob, we're going to come to Texas. We'd love for you to be our host. Where would you like to do it? And if you're coming from somewhere, people have never been to Texas. I said, let's do it in San Antonio. So we came to San Antonio. We stayed in one of the nice hotels down near the Riverwalk, because all tourists need to be near the Riverwalk. And I remember one of the opening things I said is that you're not going to find a community that's more civically engaged, more proud of its community than San Antonio. And certainly amongst big cities. You may find some small towns where there's a lot of civic pride, but amongst big cities, there's none that compares to San Antonio. And one of the fun things that I find is that when you talk about, like if I say, this is such a nice town, people will be quick to say, actually, we're the 7th largest city in the United States. And I always thought, people always say, once I knew the fact that we're so I told the group, I said, and just so that you don't forget this is all these child advocacy groups, I said, San Antonio is the 7th largest city in the United States. And if you forget that, don't worry, someone in San Antonio will remind you. And I said, when they do, please come up and let me know. And throughout the whole conference, everyone kept going, oh, Dr. Bob, someone just reminded me. So I love that about San Antonio. It's all that pride. Today's going to be a great day in terms of the panels and so forth, but I want to start us off very, very briefly with this understanding. When we look at Texas, 10% of all the children in America live in Texas. And I was just on the phone this week with the equivalent of Children at Risk in California, which is Children Now. And we talked about how if you include California and Texas, that's 25%, a quarter of all the children in America in those two states. Also in those two states, and really represented in San Antonio, majority Latino. And the other thing that's important is that the fastest growing portion of that, the children that are majority Latino by significant numbers. And so when we live in a country where today there's this pressure on immigrant and Latino communities, it's demonizing our future, right? It's making villains of our future, the very group that's going to be part of this very strong workforce. And so I think it's important for us to understand what's going on, but also for us to be able to talk about it and to figure out ways to sort of push back on that narrative, because it's an incorrect narrative. But 10% of all of our children. So what are we going to do as a community here in Texas to really change outcomes? The other thing that we know about Texas, and we especially know about San Antonio, is that we are almost overly optimistic. When I talk to colleagues around the country, whether they're in blue or red states, they're all like, oh, no one cares about children, I can't get anything done. Blue and red states, they say, talk about this. But in Texas, we see the data. The data is not good for children and families, but we're still super optimistic, right? And so I think that optimism can really drive us places. And it drives us to a place where today we get to hear these great speakers. But I want to go ahead and go to the data, because we've been doing this piece of work called the Children's Health Initiative. Nadia Salibi, Christine Thomas are two members of the Children at Risk staff who have led this in collaboration with Family Service. Nadia is our Chief Impact Officer. Christine is the Director of our Center for Social Measurement and Evaluation. Please give them a big welcome to them.
Good morning, everyone. Can everyone hear me okay? All right, great. Well, we're really excited to be with y'all here today and to talk about what we've been doing this past year. In 2025, we spent the full year engaged in the Children's Health Initiative of Bexar County. And we just completed our work last month, and we're really excited to share some of these high-level findings. Before we get into it, I want to talk a little bit about this slide and the numerous QR codes you're probably seeing all around you. We want an opportunity for folks to ask any questions they have, whether it's during this presentation, but also especially during the wonderful panelists and the discussion we'll have during that time. So please, at any point in time, if you have a question, scan that QR code. It'll be on every slide. You'll end up seeing it in the corner. Also all around you. Select the event number 18825. Go ahead and enter that in. Select new and then enter your question, hit submit. Instructions will be given to you, and at any point in time if you have a question, send them in that way. And then at the end, when the panelists' discussion has finished, we're going to try our best to get those questions answered. So excited to talk to you a little bit about our Children's Health Initiative of Bexar County. And why are we here? Why Bexar County? Well, I had numerous discussions with folks last night and even this morning, and one of the things that was constantly in the conversation was San Antonio, Bexar County in general, has a really significantly high young population. We have over 500,000 folks here that are children. Over a quarter of the population are under the age of 20. And for those that may know or don't know, within the next 10 to 15 years, there's a projected growth of over 1 million residents into Bexar County. So there's a lot happening. And on top of all that, about 22% of the residents living here are children in poverty. So of those in poverty, 22% are children. And so with that, we wanted to really explore what systems look like. And we found that Bexar County is very asset rich. I mean, it's filled with nonprofits. Estimates are 1,700 nonprofits within Dare County itself, but when you add in the 12 counties around it, it jumps up to 2,600 nonprofits. So the bulk share of nonprofits being in Dare County and San Antonio itself, 60% of those focus on community health and wellness. So much potential for partnerships, so much partnerships already happening, so much asset-based community development, which was one of the reasons we were really excited to do this initiative here in Dare County. So what we hope to tell in these upcoming slides is really a system story of how those systems are working with each other. So I'll be giving some high-level themes that we found, but feel free to access the full report online, childrenatrisk.org, or scan this QR code, and you'll find more in-depth information around the research that we did. So I wanted to start out by starting at the beginning. So when we first started exploring our Children's Health Initiative in Dare County, we wanted to look at national models and see what was out there, evidence-based models that were showing, that were addressing health disparities with the intervention of community. And early on, we came across Nationwide Children's Hospital in Ohio. So this is probably one of the largest children's hospitals in the country. And they had just published on what's called the pediatric vital sign. So by show of hands, has anyone heard of that before? Okay, great. So I get to tell you all a little bit about it. So they published about what they were doing in Ohio. And what they did is they looked at the National Academy of Medicine. And they had just finished the work on 15 core vital sign metrics. And when I say 15 vital sign metrics, when all of us go into a doctor's office, we all have fairly the same amount of things done to us, which is maybe blood pressure is checked, maybe heart rate is checked, and it's standard. At every visit, whether you're coming in for a checkup or you're sick, those things are standard vital signs that get checked. If your blood pressure is too high, if your heart rate is too high or too low, that's an indicator. That means something is happening. And then typically the health team will, jump in and dive deeper to see what's happening. Well, Nationwide Children's Hospital wanted that, not just for the individual, but for the community. And they wanted to explore how can you select vital signs that a community can look at collectively as data to say, are we moving the population forward in a positive direction? So really looking at population-based health. And they landed on these 8. And in Ohio and Franklin County, they felt like these 8, as well as in many communities across the country, they took those 15, dwindled them down, and said these are what matter for children, for healthier communities, quality of care, cost and affordability, and most importantly, engaged individuals and communities. And this is what they developed. They then took that and said, our pediatric vital signs are going to be a compass. The data that we get, whether it's childhood obesity rates, whether it's preventative care rates, those are going to be the bridge for how we design programs and interventions with clinical and, as Mary noted earlier, social determinants of health communities, so that we as a community can collectively track and move the needle on these health outcomes for our entire population, not just for a single panel or individuals we're caring for. And that became the beginning of the Children's Health Initiative and how we wanted to lay the framework down. So before I jump into what we, the findings and what we unearthed, I'm going to invite San Antonio's very own Christine Thomas from Children at Risk to talk about what we already know about Dare County data.
Hi, good morning. I'm moving to this side, so get a little bit of a neck stretch. So a lot of the same audience that each organization that reaches out to, it's typically the same with their repeated services, different services. So this is a little bit of how do we get integrated services to all of these. So 500,000 children, number 2 in the state of Texas. So we beat out Dallas. This year the U.S. Census determined 500,000 children, and yeah. So congrats. What does that mean for services? More demand, right? We need to up that. 31% of children are under the age of 6. So early education folks know that. That's pretty average actually compared to the rest of Texas, the nation. But that's about, when we put it into numbers, about 155,000. So I know it's a percentage, but think about how many children are actually 16% of children are uninsured. It's about 80,000, so you guys don't have to do the math. So do not have access to health services, dental services, mental health services, vision. So that's a big chunk of our, kids not being able to get those basic medical services because they are uninsured, or have to put parents have to take that burden of paying that out. I want to also highlight special population. We have the second highest population of foster youth. What does that mean? A demand, again, of really intense services needed. Collaborative services, so just on top of the needs in San Antonio children need, we have to pay special attention to that population in order to improve outcomes for those youth. Dr. Bob mentioned this, we're a really diverse city, so 67% Hispanic, Latino, 40% were two or more races. So what does that mean in terms of access to services? We know there's historical inequities. There's barriers in terms of language, also misinformation, right? Who qualifies for what, and distrust in our community that can happen. We have to be culturally attuned, culturally aware when we're providing services, because there is such a diverse kids. These are the future. Sorry, all right. So when we think about poverty, a lot of those in the service plan know the federal poverty level determines what kind of services are going to be accessible to a lot of our families. Just a reminder to put in context, for a family of 4, that means an annual salary of $31,000. So the thing is, you're adding up your mortgage, your payments, your child care. That's the boundary, right? 32% of San Antonio children rely on assistance. So if you're a little bit above, you might not qualify for a lot of services. And so San Antonio has a higher proportion of children living at that poverty line, right? Higher than Texas, higher than the Texas average, and then the U.S. average. One measure we do like to use at Human at Risk is free and reduced lunch. So we do have a higher proportion against, again, Texas National, but it includes those families that aren't necessarily getting those services like SNAP, but they aren't in need of food, free and reduced lunch at schools, and so included that measure as well. All right, we talked a little bit about a diverse group of children. So we know those who have language barriers or are not U.S. citizens do face fear about going into getting access to services. They might be misinformed about what they qualify, what their children qualify for. And we see that 19% of children are living in mixed status households, so they might themselves be immigrants, or their parents might be immigrants. And of that 19%, 60% are not U.S. citizens. So just kind of that demand is of integrated services, maybe reaching out to the community a little bit more. But the fear is definitely there. And what happens is that those inequities are widened, right? They're not getting access, they're not willing to go out and ask for support. It doesn't go well. Okay, so what did we do in this project? So using pediatric vital signs, we also looked into what current community needs assessments were being done in Bear County. We did not work alone. We kind of looked at those 3. So the 3 we did focus on for this report are mental health, kindergarten readiness, and then nutrition and chronic disease. So I'm going to give a little bit of background of what the state of that is now. And I know many of you guys are new, so I'll kind of refer back to last year's numbers. So teen mental health trends are improving. That is such a good thing to hear. But it doesn't mean that the work is done. There was a lot of intentional programs being done in the city of San Antonio to help improve those numbers. Big funding that went out, so it's not the time to back off. And actually the opposite, right? We need to continue these services just because these numbers are concerning. So 14% reported self-harm, 35% reported difficult with everyday tasks. Not that they're tired of going to school, they are really struggling with their mental health, they're unable to do it. One positive thing that came out of this City of San Antonio new survey, more children were saying, I have someone I can go to and talk to about my mental health struggles at exciting. I think a lot of schools are really happy to hear that. The problem is access, right? So when you see the student council ratio, for every one counselor, full-time counselor, there's 425 students to their caseload. That increased from last year. Last year was 411, so it's actually getting worse. So the demand is higher. Kids are saying, I don't want to go to someone at school that I trust. But, you know, that demand isn't being met. It is better than the state of Texas, but recommendation is 250 students. So just across the U.S., we're seeing that these needs aren't being met. So we are going to talk about nutrition, and we're talking about this in a roundabout way. We're talking about holistically family intervention. So according to Feeding America, 21% of San Antonio children are food insecure. What does that mean? So without regular access to fresh, nutritious food, you know, they could be prone to other conditions like obesity and diabetes. Unfortunately, in Bexar County, we do see pretty high rates compared to the rest of the state and the U.S. So this is 2022 data, just this is the most recent data we could get. But 15% in 2022 compared to the U.S., which is 12%, and then higher than the state average of 14%. So what is going on? I think a lot of it is in your own service and advocacy organizations. You can see that it's, you know, we've talked about they have to either choose paying for their health bill, their rent, or their food. And so there's a bigger story going on, and then, yeah, we know 2021, like, there was a huge dip. Why did it go up so high? Right, there's a lot of supports during COVID. Everyone received free and reduced lunch at schools. There was a lot more food supports, and then all of a sudden, that money went away, right? But that demand was still there. And so this is more about how do we bring family into this. It's about, you know, health literacy, and preventative care when it comes to nutrition and chronic diseases. All right, last thing we're going to talk about is kindergarten readiness. 49% of students in Bexar County are considered kindergarten ready. That's lower than last year, by the way. So that number keeps going down across not just in Bexar County, but in Texas. And then, sadly, the number of kids who attend pre-K is also going down in Bexar County and Texas. So there's a lot of great programs that are incentivizing free pre-K, all-day pre-K, things like that. And research shows access to pre-K actually boosts achievement gaps early. Even if you aren't kindergarten ready, it shows to like close those gaps a lot sooner if you didn't go to pre-K, because you have that foundational social emotional learning and the skill sets that you can catch back up pretty quickly. So why is that, right? A lot of it has to do with access. So pre-K is expensive, right? There's what I talked about, under 55,000 kids under the age of 6 need seats to pre-K. In terms of substitute childcare seats for low-income families, there's only 24 seats for every 100 children in San Antonio. So a lot of it is just, there's no seats, right? How can you get these kids in those programs if there's no space?
Thanks, Christine. So I get to now transition us a little bit into the work we actually did during the year, or one of our favorite things to do, which is community engagement. So the Children's Health Initiative model is really 3 phases. That first phase really being focused on listening and engaging the community, seeing the data that's already out there, the studies that have been done, talking to the community, understanding what they prioritize as the biggest needs. The second phase would then go into leveraging the information provided into pilots and being able to actionalize things that were discussed during that listening session stage. And then lastly, looking at impact as a form of sustainability. So we're really in that first stage where we're able to present the findings that we discovered this past year. And to do that, we engaged in about a dozen interviews with community partners, primarily service providers. Many of you might be in the space here today with us. We had, in partnership with Family Service, 3 focus groups with community members that resulted with 30 community members total. And then in partnership with the Baker Institute, we were able to produce a resource map. In addition to that, we also were able to do a partnership convening and bring all the partners that were working on the ground together to discuss action plans. So I want to start out talking a little bit about our work with the Baker Institute. And what they did was really focus on access and utilization, and specifically the 3 domains that Christine just went over, which was the focus of the Children's Health Initiative: mental health, nutrition, and kindergarten readiness. And they put together a variety of variables, domains under those 3 categories, and presented it as a way to layer risk. So what you're seeing here is just one example of how you can look at data. This is a map of Bexar County by zip code, and what I did in this one was to show 3 indicators under each of those domains. So one being schools that do not have TCHAT, which is the access for telehealth in schools for children to be assessed for behavioral health and mental health services. Also, it includes food insecurity rates, as well as preschool enrollment rates. You can select other indicators that are available. Those were the 3 I just happened to select for this one. And the darker you see the zip code, the more disparities there are. And so we wanted to do that to see where we saw greatest disparities, so that when we talked with the community, we could understand better where partnerships made more sense, or where they felt like it made sense to have partnerships based on gaps and needs that they were seeing, at least visibly in a geographic space. So that's something that's accessible online in our report as well, and can be used in different ways. We then spoke with community partners through interviews. You'll see some quotes up there, but overall themes that came about were around challenges that they were experiencing around providing access. So complex navigation systems. So someone's coming to maybe receive mental health services, but they're also maybe struggling with other things like housing or food or just medications, whatever it is. And there's no real bi-directional referral system in place for them to make those referrals and then see if those referrals are successful. So they communicated a lot, these complex navigation systems, applications, eligibility, all of those things combined in there. Service equity. So this is a theme you'll see over and over again. Christine obviously touched on that with the data. It wasn't just geographic disparities. It was compounded with, yes, there are regions where there are provider deserts. We might be the only one providing services there. But it's also that the demand is rising. Younger kids are needing services. And then also that there's shortages in the workforce. So all of that combined was really creating this service inequity. Challenges were also presented with physical challenges because of those shortages and those deserts. Families are having to travel far and wide to access, so transportation became a huge barrier, language, documents, and having staff that are multilingual, in addition to the mode of service. So there were a lot of telehealth, options, but folks wanted in-person options. So that created another barrier for the providers. And lastly, they talked a lot about their outreach strategies, and a lot of them they felt like were actually being very effective. But one of the things they struggled with was how to get the right information out there without it being overwhelming and too much information. So they were finding that there were certain services that were being offered but were being underutilized because folks didn't have the right information to access those services. In those focus groups we had with community members, what you'll note in this word cloud here is a lot of the same themes. So they corroborated a lot of the same things we heard from community partners. Transportation, they talked about having to travel far to get services because there was nothing in the neighborhoods that they lived in. The sort of lack of awareness, they would get information, but they didn't realize that, for instance, their 2-year-old actually qualified for, example, early childhood education services. And then language was another big issue where not having the staff to respond back in the appropriate language that made them either feel comfortable or was understandable for them to pursue the services. Some other things popped up though too, which was cost. A lot of times there were services from the public sector, but they were starting to turn towards the private sector because it was maybe more easily accessible. But at the same time, the fees were just so high. It was making those trade-offs. Do I pay for that and then not pay for something else in order to receive the service? And then the smaller sort of words you'll see there were things like conflicts in when programs operated, their times, right? They're working, most of the folks we talked to, so they couldn't access those services. So really great feedback from our community members. And what I'm going to ask you all to do, because we want to hear from you all, and we're going to hope this works, is if you have phones, please scan this QR code, and we want to hear from you of those three indicators: mental health, nutrition, and kindergarten readiness. What do you think is the biggest priority for Bexar County? And we should see this real time. This is great. All right, I think we're at a good place here. And so what I'm seeing is mental health is really rising to the top as maybe the biggest priority from this crowd here. Nutrition and chronic disease, and kindergarten readiness. Well, I'm going to say you guys really know your community, because that's what they said. When we asked them, what would you say are the biggest priorities that you're experiencing in your family? They communicated they're all needs, but if you had to pick 1, 2, and 3. So very much in line with what you all are saying here today. Mental health really goes to the top, followed by nutrition and kindergarten readiness. Okay, so system gaps and opportunities we're going to talk about. So this is where we really got to dig deep into the input provided by the community, delve into this partnership workshop session that we had. Actually, in this room, it was filled all around the walls with Post-its and big whiteboards, and we got to develop action plans that the community partners felt were things that they could feasibly lift off the ground. So I want to talk a little bit about the gaps. These were cross-cutting, regardless of whether someone was a mental health provider or in the nutrition space or kindergarten readiness. Service deserts popped up so much, in that there was so much need and they just didn't have the capacity to meet the need. The demand was just so high, and geographically it was just so widespread in regards to where the deserts were, specifically in that southern sector of the city and the county. That's compounded by transportation barriers, right? It's not that transportation per se is the issue, although definitely part of the problem, but that they're having to transport themselves. And folks want to invest in their neighborhoods so that they don't have to travel wide and far to reach services. And then lastly, system fragmentation. This was very complex. This was, we really want to support our community members with services they need, but it's really hard to get them from one place to another and know if the referral was successful, and how do we get these systems to communicate with each other in the same way that maybe an electronic medical record would sort of communicate within a hospital system. And so they emphasized these 3 areas where they really wanted to see action. And so the first one being cross-sector coordination meetings. This often takes place within systems like a healthcare center and other places, but they wanted to see it community-wide. And so they did something called value exchange mapping in our workshop session, where they not only talked about the assets they have within the services, but just within their facilities. So they might have meeting space room, or they might have technology, where another provider is a mobile unit and doesn't have those and could benefit from those. So how do we share those resources and those capacities that each other have and leverage them? The second was the services. So you need to understand exactly the services that were being provided, the times, the eligibility, all those things that maybe you don't find online right away. And then thirdly, really being able to have the relationship built. So that warm handoff. Who do I know here that I can actually call and get someone in, or take that referral, that navigation route to get folks that I'm serving into care? The second strategy was around philanthropy. So a lot of them noted how they're going in individually, engaging philanthropy for funding for their work, but how they really wanted to work together collaboratively and address more holistically the well-being of a child and make a greater impact. And how can we do that and move that forward? And the last area was investing in culturally appropriate resources, so whether that was staffing or documents, or even the appropriate food within a food pantry, knowing your population and knowing how to serve them. So in the end, they landed on 5 action plans that they wanted to see move forward. There was many others that they discussed, but these were sort of the top 5 that they felt like were actionable and could lead to real impact in the Barron County community. The first one being one-stop access points for where families gather. So that referral disconnect that I talked about earlier was a real problem, and they wanted to have a one-stop shop. So how can we collate things, or how can we have navigation within the space that we're serving so folks aren't having to exit and leave and potentially not receive that service or not know if that referral was successful. So going really from large referral lists to actionable care navigation. This is reflected in places like communities and schools, that's in ISDs, the Mobile Mental Wellness Collaborative that goes to schools and are co-locating. So they gave examples of partnerships that were really successful that they wanted to mimic and grow. The second action plan was around growing partnerships based on rising demands. And this was really in response to the workforce bottleneck that they were experiencing. So they were often saying that, we have folks coming in to the point where we can't meet the demand. And so instead of growing our services, how do we grow our partnerships with institutions and training pipelines so that we can meet the demand and bring those staff in more easily? Examples were with how the Center for Healthcare Services has the peer specialist certification, and those are actually reimbursable by Medicaid. And so how can we get folks in those and then actually get a revenue stream in? So really wanting to explore those avenues. The third was really being intentional about partnerships. So there might be needs that the community that you're serving has, but are the partners coming in easily able to meet those? So wanting those low or no barrier partnerships. Organizations like the Food Bank, the San Antonio Food Bank, and the Community First pantries that they supply were heavily noted as how can we bring these in so that we know that our community can actively access those services, either on-site or online. So making those very intentional. Prioritizing investments in service deserts. So there's this concept of infrastructure-based funding. So that's my building is here, my brick and mortar is here, and so we're going to invest on this capital and fund this capital that we already have built. And how can we change that mentality to equity-based funding? So we know that the need is over there, and so we want to invest more wholeheartedly in the service deserts so that we're growing and addressing the needs that are existing. And then lastly, they viewed this one as a more low-hanging fruit one because they felt like they were actively working around this, but targeting those sort of high traffic areas. And when I say traffic, really foot traffic. So anything or any place where there's a waiting room, bus stops, shared rides, Lyft and Ubers, clinic waiting rooms. They really wanted to be strategic about QR codes being placed there so that people can enroll and navigate, or putting navigators out in the community in those spaces to help folks do that. They highlighted how Haven for Hope, built their shelter in the space where those experiencing homelessness were actually residing. So just wanting to really direct the services where the folks were waiting or present. Are we going to get this one up and running? So we have another poll, the last poll we wanted to ask y'all, but if this isn't able to run, we might have to skip it. Okay, there it is. So if y'all can scan this QR code that just popped up. Yeah, real quick. And it basically is asking those 5 areas of which one do you think, if you had to pick one collaborative strategy, which one do you think could help actually reduce health disparities in Bear County? All right, so the 2 I see rising to the top, or the 1 is prioritize investments in service deserts. And a lot of these bleed into each other, right? You can do that and then hit some of these other areas. And then one-stop access points for workplaces where families gather. So thank you all for engaging us in that. This is really helpful. My last slide, and then I'm going to invite some guests up. What's our next steps? Well, we want to move to that next phase, which is really pilot. So how can we pilot some of these action items that we've listed up here into settings like schools, like hubs where families gather, like early education centers? How can we do maybe these coordinating convenings with community partners? So that's what we'll be exploring next. So thank you all, and I'm going to invite United Way from San Antonio and Bear County up on the stage, as they have a few slides that they want to present around kindergarten readiness.
Hi, good morning, everyone. My name is Keandra McCracken. I'm the Impact Manager for our Ready Children Impact Council at United Way. And in my role in the team that I work for, we invest and partner with about 28 programs currently who work with families with children 0 to 8 in 4 investment areas, one of those being kindergarten readiness. And our overall result is to ensure that all children are happy, healthy, and ready for kindergarten in Bear County. And I'll pass it to my colleague to introduce herself.
Good morning, I'm Jackie Hernandez. I am Impact Data Analyst for Ready Children, and one of our other initiatives are Successful Students Impact Council. But today I'm representing Ready Children.
And so we've heard throughout the conversation about kindergarten readiness being the foundation to set up our children for life. So about 14 years ago, United Way wanted to prioritize investing, or continue to prioritize investing in kindergarten readiness for our children. But the question is, how exactly do we measure kindergarten readiness across our city in a more unified way? Even when you think about the kindergarten assessments that are required by school districts, whether that's the M-CLASS or the TXKEA, districts are allowed to choose between those two. So there's not a unifying assessment. And so that's how we ended up with the early development instrument. And so what is the EDI? It's essentially a tool used to assess the well-being of a child and how well prepared they were for kindergarten. What makes this unique is the results are not given based on an individual child, but it's rather looking at how well the community, right, the organizations, the infrastructure we talked about, whether that's transportation, sidewalks, parks, libraries, thinking about the community a child grows up in and how well is that community off to prepare a child for kindergarten. And so just really want to emphasize it is a community measurement. A little bit of how it's completed. So we do this in partnership with UCLA and the school districts within San Antonio. UCLA is our holder of the platform the teachers use to do the assessments. They are also the holder of providing back the data to us as well. And I really want to hone in on this partnership. So I've been with United Way for about 2.5 years. I've been through 3 collections of EDI, but like I said, the EDI has been done. We've been doing it for about 14 years. So I stand from the people before me who built 14 years worth of relationships with the school districts that we partner with. And the 3 of the school districts that we're currently partnering with have completed a collection of EDI, either all 14 years or most of the 14 years. And so I really want to highlight that collaboration and the relationships that we've built. And so a little bit about how teachers complete the assessment. So it's kindergarten teachers complete an EDI assessment on each of the child in the classroom. And it's based on observation recall. So the teacher must have been with the child at least 1 month to just be observant of the behaviors, their skills, and things of that nature. And it's completed in the first 3 months of school. So like I highlighted before, it's really focusing on not what's happening in the classroom, but before the child gets to the classroom. And so we try to complete it within the first semester and a half of the school year. And so again, to highlight what it doesn't do, it is not used to assess the teacher's performance. So a teacher can never be singled out for what the results will show us in the EDI of their classroom. But it's also not supposed to be used as a tool to screen or diagnose or identify any developmental delays within a student. Again, it is a community measure, not necessarily a tool to identify any developmental delays. And so the EDI gives us measures the children in these 5 developmental domains. Communication skills. So it's just measuring, can a child communicate their needs to their teacher or to their peers? We also have emotional maturity, which is how empathetic are the children to others? Are they willing to help their other classmates or teachers? Looking at the physical health and well-being. So that's looking at the fine and gross motor skills. So can a child hold a pencil? Something as small as that, or even do they have energy to last throughout the day? I know we're looking at 5-year-olds, so even we can't last throughout the day, but it's really looking at that repeated sustained energy. Language and cognitive development. So those are your typical skills measured in kindergarten readiness assessments. So those are your numeracy skills, your writing skills, as well as memorization skills, say of shapes, numbers, and things of that nature. And we also have the social competence. So that's looking at, can they follow instructions of a teacher? How well do they get along with their peers when they're playing, and things like that. So what really sets this apart from other kindergarten assessments is we're not just focused on those academic skills, but we're focused on, or it's focused on the holistic well-being of a child. And so, don't necessarily have a slide for this, but I do want to connect it to what's been said before, is we use this as a tool to prioritize those service deserts, right? This tool lets us give us a snapshot to look at certain neighborhoods of, okay, we see that our children are in kindergarten readiness. Let's zoom in and see what's going on. Looking at, do they have those, is there a pediatrician? Like, what does the healthcare system look like in that area? Looking at what is the quality of the early childhood care centers that are within that neighborhood? Looking at the parks, looking at the libraries. So it gives us a chance to look at those neighborhoods where we need to prioritize investments, but also looking at the neighborhoods, okay, these neighborhoods are doing well. Okay, what are they doing well that we can bring over here? And I'm going to pass it on to my colleague, Jackie.
All right, no presentation on data development, which would be complete without the data behind it. So what you're looking at here is our most recent snapshot of our EDI collection data. So this is covering 3 school years from 2023 to 2025. You'll see in this time span we had 6 school districts participating, which equals 22,778 children throughout the 3 years that we were collecting this. And so we combined these years instead of 1 year at a time to see kind of the trending data across time and to have a larger sample size to be more representative of the community as a whole. Out of those children that were assessed, you'll see vulnerable, at risk, and on track. So for vulnerable, for a child to be considered vulnerable on this measure is done in other communities throughout the country, so we're not the only ones who do this. So this is kind of a comparative analysis of how children in Bexar County are doing to a national sample. For a child to be considered vulnerable, they score at below the 10th percentile on this measurement. A child who is at risk scores above the 10th percentile, but below the 25th percentile. And then a child who is on track is 25th percentile and above. As we're seeing here in Benner County, 27% of our children in kindergarten were considered vulnerable at the time of these assessments. And over half of our children were either vulnerable or off track, so 58% of those children. We do have, not shown here, but we do have that geographic data where you can see where those disparities are. And you can feel free to reach out to me or Keander, and we will be more than glad to share that with you. That has maps about how each neighborhood is doing, what the indicators we track are, like OBGYNs, access to pediatricians, access to child development centers. So we have a bunch of data on those maps, so feel free to reach out to us for any inquiries about this data, and we are more than happy to walk you through it and share it with you.
Thank you.
Thank you.
Thank you, guys. Panelists, come on up. So we have a super esteemed group of panelists from all over the state of Texas, and also from Yale University up in New Haven. And we also found the most uncomfortable seat possible for them in the wooden benches. So we travel far and wide for that. So I'm really excited. Yeah, I know. Let me just quickly introduce him. Enrique Mata is down at the end from El Paso, Executive Director of the Paso del Norte Center for the Meadows Mental Health Policy Institute. We're excited to have him here in town. Monica Ordonez is in the middle here. Monica is the Program Director at Bachman Lake Together. For those who don't know about Bachman Lake Together, wonderful early childhood organization up in Dallas. So wonderful to have you here, Monica. Dr. Carmen Valdez is in the peach color there. So she is here in San Antonio, professor, and she's the Associate Dean of Research and Partnerships at the University of Texas, San Antonio School of Public Health. Great to have you here as well, Dr. Valdez. Next to Monica is Dr. Alfonso Mercado. He is down from the Valley. So did you drive up this morning? Last night, yeah. And he is a professor at the University of Texas, Rio Grande Valley, and directs the Multicultural Clinical Lab there. So we're excited to have you here as well, Dr. Mercado. And then Dr. Julia Rosenberg out of Yale University, the School of Medicine there. She's a professor of pediatrics. She's done a lot of work, especially for immigrant and refugee children. So we're excited to have Dr. Rosenberg here as well. I'm going to ask all of you the same first question, and just so that you can put it in your mind, I'm going to go to you first, Julia. But the question basically is, we brought all of you here from, most all of you here from out of town, and we want to know what programs have you been part of or that you know of that you think could work in a community like San Antonio. So what sort of extraordinary programs are going on around the country, around the state, that we really need to be thinking about in San Antonio that fall within any area here? So, Dr. Rosenberg, how about yourself? And welcome, by the way, to Texas.
Thank you so much for the very warm welcome in many ways. It is really such an honor to be here and to hear about the incredible work and partnerships that are going on here in San Antonio. I think that specific examples of partnerships that have really reached beyond are often, at least within our community and in our clinic, we have a refugee and immigrant clinic, are really where there are opportunities not only for formal partnerships but really constant communication as well. One of the things that has really expanded our ability to support our refugee and immigrant community within our much smaller state in Connecticut have been opportunities where we now have very frequent collaborations with school systems, health providers, community members, and people with lived experience all coming together to learn from one another, not always with an agenda in place, but really for our forums to have opportunities to connect and hear about where there are needs and where we can know each other and communicate further. What's really helped with that, in addition to finding specific problems that we're able to solve, whether that's eating in schools because there's not dietary accommodations for refugees, for example, who come from Afghanistan, and we were able to make changes and learn about the causes of abdominal pain that we were seeing all in one forum. It's also that we're able to know familiar faces and know who to reach out to and have those first steps whenever there's an issue that comes up, rather than referring to a kind of nebulous, undisclosed connection and partner who we know is doing good work, but we're not exactly sure who they are. So those types of really close communication and connections can make a big difference in our community.
And if I could press a little bit, like, what's going on there that you think we could be doing here in San Antonio? And the question doesn't have to be about partnerships, but what are some of the things that are happening that we really could be doing here?
I think that a lot of the partnership discussions have resonated so strongly, and I think that the steps that have been discussed here already are making so much sense. I think it's just finding those opportunities for creative discussion forums and venues often is where those connections happen and solutions can come up over time. That has been a constant experience for us. We have a capacity building research initiative where it's really bringing people from the community with varying levels of education, varying language backgrounds, making sure that we have transportation, child care, opportunities in person and Zoom. So lots of accessibility for these opportunities. But really the constant connection here is opportunities for consistent communication and being able to meet one another.
Very good. Dr. Mercado, if anyone goes to the Valley, and I've been to the Valley so many times, you find that the need for children and families is tremendous, but it almost makes people work in partnership even more, I see. I mean, there's a lot of good stuff going, but if you could sort of pick a program or something that's happening in the Valley that you would bring here, what would it be?
It's a great question. Raise your hand if you've been to the Rio Grande Valley before.
There you go.
Like that. So they know where the 956 is.
Also,
I'm a native out of Reno, and I've been living there since 2012, and the Valley is a jewel of Texas, I think.
Yeah.
Very culturally rich. I love where I live. And as many of you know, we're an underserved community of healthcare, right? We are missing about 200 psychologists like myself to meet national health standards. Also, as some of you may know, the Rio Grande Valley of Texas is ranked, has one of the highest rates of poverty, right? Diabetes and obesity, right? So unfortunately, we are on top of the list of the healthcare disparities, right? One of the things that myself and my colleagues and my doctoral students do is we live and work in the community. When I first moved down to the Valley from LA, when I was developing my lab, I wanted to make sure I was addressing the needs of the community. And one of them was the immigrant and the undocumented community. In addition to working with different community partners, getting to know the leaders in the community. We worked at the tent encampments in Reynosa, Tamaulipas, doing clinical research. We've worked with humanitarian respite centers with Sister Norma Violente in the community.
Yeah.
In addition to other leaders getting to know who they are, not only wanting to do research, but to be part of the community, right? Sitting on the boards, and having that trusting working relationship with them has opened the doors to research and multiple grants from the National Institutes of Health that we currently have. So I think the relationships with the community leaders and partners is critical, especially when we live in a community like the Rio Grande Valley, because many of those people and many people here and across the country right now don't have a voice, right? So being privileged in a position as a psychologist and doing clinical research, shedding light into the realities of what's happening right now, in many different examples, right, is important. So.
Yeah. Any specific thing that you see that's happening there that's sort of unusual in the Valley?
Well, right now, the science that we've collected throughout the years has definitely shared into a crisis that is currently happening in our country, especially in South Texas and the border. And that is the only crisis that science is leading to is the crisis of mental health. Yeah. Right? Mental health not only with our immigrant and refugee population, but also the American folks like us, Westerners, right? I chaired the American Psychological Association Presidential Task Force on Immigration and Health. And one of the conclusions was just that, right? That trauma and mental health right now is something that we're currently experiencing, not only among these vulnerable populations, but our neighbors, right, people that live here. So I think that is a take-home message where, trauma-informed care and culturally congruent treatment interventions is really important right now.
I think it was interesting you mentioned Sister Norma, who I've met many times. Sister Norma, if you don't know, sort of runs Catholic Charities in the Valley. She's probably the only sister, the only Catholic nun who has been nominated for the Nobel Peace Prize a number of times to be sued by the Attorney General. So it's sort of all But here's the thing about Sister Norma. She loves that stuff, right? She's just like, yeah, give me more. So, Monica, sorry to have you follow the Nobel Peace Prize. Monica, again, I want to get at this. Are there programs happening in Dallas or Fort Worth area, maybe early education-wise, that you just think they're so extraordinary and we should be bringing those somewhere else?
Yeah, I mean, I think you all touched on it a lot, just about the coordination and the collaboration. But, just speaking for Rockland Lake Together, we are known for early ed, but I think it's the approach. And the approach is we're an organization that focuses on collective impact, meaning we bring partners together, but we don't do that alone. So we're a place-based organization focused in the Rockland Lake area, which is right behind one of our airports
If you fly in Southwest and Love Airport, you're right over Rockland Lake.
Yeah, you're gonna.
Right over.
Planes go over all the time. We kind of just stop talking and then pick up our meeting where we are. But the thing is we don't do this alone. So if we're servicing the community, we're serving it with the community. And so when I talk about collective impact, I know that's a lot of jargon about what that really means. But we hold coalitions, and so we do them quarterly. We have working groups that are boots on the ground. But our parent leaders, which is our only direct service that we do, and that's about, I think Nadia presented it, about bringing those systems and those education to the communities and bringing it from an asset-based stance. So they want to learn, they want the information, but the systems were not built for them. And so it's really educating them on the system, which we started off with education, and then we started peeling back the onion, and now we're doing health and housing and all these other different systems. But it's really bringing in the community, and then it's bringing in those partners. So those partners have direct access to the families, and the partners are sharing the information, but the families are sharing what is the root cause that's really happening in this community. We know a lot of our communities are desert. We don't have childcare. We don't have, there's food insecurity. But those partners are coming to them instead of our families having to go get those services that are not located close to them. So I think just having that type of approach, because when we talk about community voice, like it has to be true community voice. Like, we for so long we always went into communities and said, this is how we're gonna fix it. And it's not about fixing it, it's about doing it with them.
It's interesting, during the press conference, Carmen and I were talking about this whole idea of the community, really getting the community sort of feedback, and how many heroes there are in the community that are so engaged. And in general across Texas, we don't see a lot of groups like yours that are doing that, right? That are sort of really engaging. When I go up to Bachman Lake, it's really interesting to see that community is super engaged.
Yeah, so we really started off with, we brought partners together, and then one partner kind of stepped away, but we knew that the Parent Leadership Program was really the one that was leveraging all the work. And so when we talk about it, like then this Parent Leadership Program we created it organically because we created it with the parent leaders. So we had a level one that was just about, why is it important to send your child to pre-K? And we built this whole campaign around kinder readiness. It was an enrollment campaign. We did canvassing, boots on the ground, grassroots efforts. But then the parents actually came to us after they've been participating in a while and said, we want more. Like, what can we do? We know there's other things out there that we know are impacting our community. And so we're at our third level now, and we're actually in the process of codifying our curriculum. But the piece that we do now is that we're training our parent leaders to go out, and they're doing peer-to-peer support, because they're the ones that are the connection to the community. But it's taking a bit, because you have to build that trust. And so I think when we talk about, the fear in our communities, I think I was talking to Julia earlier this morning, and we were talking about, are we seeing a reduce in attendance? There has been, but another place is that it's a safe place for them to come.
Yeah, very good. Thank you so much. Dr. Valdez, you spent a lot of time in Austin. You're now in San Antonio, focusing on partnerships, but you've seen a lot of programs over the years that work, some that don't work. Is there one in particular that you can think of that really think we can maybe bring this here?
Yes, in Austin, there's a program that I was involved in that was a partnership with our Safety Net Hospital and also local ER.
Yeah.
And what we did is that we deployed community health workers to these settings. So
Yeah.
anybody coming into the ER or being seen, this was during the pandemic, being seen for COVID, would automatically be connected to somebody from their community who is trusted, speaks the language, understands the issues around housing insecurity, food insecurity, to help them navigate the system while they were in the hospital, but also to then help them connect to services beyond the hospital. And that's often where our community is coming back to the hospital because the unmet needs are so great. So the other piece that was really helpful about that project is that Austin has a program called Find Help, which is a closed loop referral system. So if you are a community health worker, you can connect and refer a resident or a patient to a variety of services, and the closed loop aspect of it tells you if they actually received the service or not. So often when we refer people, they get lost through the cracks. We don't know if they connected, if they received the service, if their need was met. So being part of this closed loop referral system that was citywide, and the United Way was involved in that, and the city of Austin was involved in this, was really key to making sure that people were getting the support that they needed so that they could stay out of the hospital and not come back.
Yeah, very good. Thank you very much. Enrique, out in El Paso, I mean, what a great town El Paso is, right? I mean, and you grew up there, so you don't know any better. But I wonder, around the area of mental health, what are the things that are going on there that you're just sort of like, wow, we're hitting it here?
Well, thank you. Thank you again, Dr. Bob, and to Mary and Nadia and Christine and everyone who helped get us all here. It's exciting to see this group of people in the room and listening to these questions. One of the things that I really think about is how many years it's been that we've been trying to cultivate collaboration in our region. And as much as everybody can reinforce, we can't reinforce enough that collaboration among the partners in the community, government, education, private sector, nonprofit, all of them coming together is really, you've got to keep that going. And one of the things that we do as a transparency, we have a website where we post our meeting notes from all of our community meetings that we have. We try to keep that high degree of transparency so that folks can follow. We don't want people suffering from meningitis necessarily, but that people are following these data-informed moves that we're making in the community. And so, and then every year we have at least one general event, something like this, where we bring folks together and see if we're doing a good job with people who are hearing that things are changing. From the program side, if we're looking at programs, much like the bidirectional resource, we have a health information exchange in El Paso that's become very strong, and it's got over 400 partners. And now it's finally getting to a point where we are seeing some opportunities to do bidirectional resources. And when that happens, and this is in mental health as well.
Yeah.
We're one of the few communities that has our local mental health authority, Emergence Health Network, is a signed-on participant in the health information exchange, as well as the Department of Defense for active duty military, because we have one of the biggest military bases in the country, and also the Veterans Administration is on there. And so with those partners and all the healthcare hospital systems, they're all signed on, and so we can really do our best to get the timely access to data to providers across these resources and help ensure that people don't fall through the cracks. It's still happening. It's something that's an ongoing challenge that we have to face. But with the challenges, it's mostly because of those kind of deserts where you have primary care practitioners who are seeing 40 patients a day. And the most they can do is get to a patient for 3 to 5 minutes. Try to address their problems. Whether it's a mental health condition, you need to have stronger resource referral and better coordination. So we're trying to train them on collaborative care. We're trying to use the assets that have been developed as a result of policy changes, like when children in risk presses to the legislature, the Child Psychiatry Access Network and Texas Child Access to Telehealth, those TCHAD and CPAN programs are helping. They really are helping our communities to get access. So CPAN is one of those programs where a pediatrician can say, you know, I suspect that this child here is having some concerns. I need to help this family. They can call on the psychiatrist, child psychiatrist, and within a number of minutes, get that child psychiatrist on the line, get them the help that they're looking for, confirm the condition, and collaboratively work on a solution that keeps them in the primary care setting, and they follow with the primary care physician, and then coordinate their care along that side, so that the child never has to really leave if they're not having a serious specialty type of situation, that they can get that support they need. Similarly, the TCHAT program in schools, I can't reinforce enough that that's a really important component, because those first stage symptoms that come on, maybe not coping well in school, maybe having a trauma, those kind of things, if you can get them connected with some first line assessment that helps them to connect with services in a timely way, you can often prevent serious situations, not just in the early stages when you say you're preventing crisis at the stage where they're first identified, but also over the long term, because children who have had their conditions addressed early are less likely to have situations like risky behaviors when they get older. So we're seeing more and more of that. We're learning more about mental health, and we're really excited about programs like that. The other thing that I'll say really quick is that trauma and grief keep different things. And there are different approaches that we're learning more and more about. And thanks to the Mental Health Policy Institute, we have the Hackett Center, which has Dr. Julie Tecto, and El Paso has engaged in trainings from them that help us now to have several providers in our community that have specialty care for situations that people are not coping well with grief at all ages, or coping well with serious traumas. And so there's different types of therapeutic approaches that you can take that may help. And we're glad to see those coming into our communities.
Yeah. And Megan, I wanted to ask you specifically, we have a whole team in Austin, and what we're seeing around mental health, what we've seen over the last decade is that Texas has become a little bit more open to investing more in mental health. So seeing the numbers that San Antonio is doing better than many other places, I know they're doing far better than the Houston area when we look at those numbers of counselors per child. But we also see in Austin sort of a growing movement of this isn't very Texas-y to be focused on mental health, right? That we're an exceptional state. Do we really need to do this? And where do you see this going? Is that just sort of a blip, or do you see the other thing, the sort of the growing focus on mental health being sort of the leader there?
Well, okay, I'm not going to do a data informed. I'm just going to do
that's what I'm
observation.
observation.
And what I'm seeing here is one of the most important things that I just saw on this screen right now is that this community is thinking mental health is a priority.
Yeah.
Much like El Paso, we're seeing mental health as a priority. That strength in numbers is going to force a culture shift, a shift in the way we think about our policies, our practices, in that saying that mental health is just as important as physical health, and it should not be ignored no matter what age you are. Older adults, we're seeing that the state has now invested in looking at dementia prevention research, much like they're looking at cancer research. Those kind of things are vital for our communities to have overall health and quality of life. And I'm thinking that Texas is going to have to sway to where the numbers go. And if the people in the community consistently say mental health is a vital priority for us, overall health, we have to keep moving to find the best solutions possible.
I actually think it is a blip, but it's like such a stupid blip, So I think we're going in the right direction. Alfonso and Julia, I want to ask you in relation to mental health and specifically around stress and the immigrant community. And sometimes we talk about the immigrant community, but you have to understand that it affects the state as a whole, that it affects Latino families in general. And I wonder, Dr. Mercado, if you could sort of address, where do you think we're going? What are some of the stuff that you are doing specifically around that?
Yeah, one of the things that we shed light in the APA's Psychological Science and Immigration Today report highlighted best practices when working with the immigrant population in regards to evidence-based treatments, culturally adapted interventions, which is very important. In addition to looking at research practices, we highlighted effective ways to work with this population, on the ground, which is very different, right? And it looks very different. In addition to looking at teaching, right? Teaching future mental health professionals, right? Most of us here are mental health professionals, but the future of the mental health profession, right? Giving them those tools necessary to effectively work with this population. And one of the things we also highlighted was the advocacy, right? I think it's very important to leverage science, and many of us in this panel do that. Right, looking at science and leveraging it to inform policy, right, and programming. One of the things that APA, the American Psychological Association, has been doing behind the scenes, as you can imagine currently, is working with members of Congress, right, folks that make laws, and seeing what kind of bills highlight that need of trauma-informed care, which many communities don't have those resources. Right, not only providing trauma-informed care to the most vulnerable, right, the undocumented immigrant population, but we need to also provide those kind of services to law enforcement, because they're the direct line. In the Rio Grande Valley, not too long ago, we had 5 suicide completions of Border Patrol agents in a span of 2 weeks. Right, so the crisis of mental health is real, right, and it's affecting not only the most vulnerable population, but the U.S. citizens too.
Alfonso, I think it's interesting you said y'all, and you came from California, so thank you very much.
I started speaking like the 9562. It's contagious.
Julia, how about for yourself on the mental health, immigrant, and white communities?
The emphasis and appreciation for how important mental health concerns are and how it's being recognized within communities, I think, is so strong. And then it's a question, and the importance of all these evidence-based interventions and making sure that we're having these interventions available in ways that are culturally and linguistically informed, ideally with people with similar backgrounds and languages, but not with access to those services. But it's often still that next step of actually making that happen and connecting with care. From the general pediatrician perspective, prevention is my bread and butter. It's what we really care about. It's having kids come in for their well visits and recognizing, let's talk about what to expect when your child reaches that next milestone before we even get there. And so similarly, I think for mental health, a lot of what we need to focus on is that prevention side and thinking what can we offer almost universally when it's so difficult to get those next steps. Like thinking about the strengths that families have and how to support them is something that we can often do much better from the primary care setting, and it's fantastic to have resources like when we also in Connecticut have mental health experts we can call in the moment, making sure we have a plan keeping a family within a medical home. But what about prevention? And so thinking about preventive mental health, that's already often integrated into educational curricula with things like social emotional learning activities that are evidence-based, but they're not accessible for folks who may speak other languages or come from other backgrounds. So finding ways in as many settings as we can, this is what we're doing in our region, of offering kind of opportunities to learn about emotions, learn about coping mechanisms, and normalize talking about these things early on. One of the other things that we do in our refugee clinic, that's when the very first visits, and then we become the medical home for most families. Those first visits are often the whole family. It's often a 4-hour visit for the whole family together. And during that time, we usually have a mental health provider that pops into the room in between all of us going in and out of the room, just to get to know the family. If there's an urgent need, we can address it. But what usually happens, and there's a lot going on that first day, is this is the person that you recognize who helped to talk about these different things, often in fun and exciting ways for kids, so that in the future, if there's needs that arise related to mental health, it's, we're going to connect you with this person that you already met, who already had a strong relationship with. It's not a scary unknown. And so those ways to lay groundwork for prevention are really, what we're learning is one of the important aspects to then open the door to connect people with the services they need when the needs
to switch a little bit to food insecurity. Monica, I want to ask you about this. Last night, during the very, very long State of the Union address, Trump mentioned that he had pulled off all these kids all these families off of food stamps, SNAP. And, he was very proud. He made it sound like he grew the economy something up, but the reality we know is that it was just taken away from them. So we have more food insecure families. How do you guys deal with that? And what do you see in the community overall? Because you're working with a specific population that would fit into San Antonio, Houston, it would fit into any Texas city. But food insecurity, how does it manifest itself? And what do you see happening now that it's become a little bit more difficult? Because we had a lot of difficulty with new immigrant populations to begin with in terms of food insecurity.
I'm glad you had to ask me the question after the Trump comment, but
I know that you have no political views at all. So
I think when SNAP was removed, because Bachman Light Together is a collaborative organization, so we are the backbone. We were able to bring those partners together that are already providing those, but they concentrate on food insecurity. And I think the one thing they did tell us, which is interesting because we started okay, let's build community leverage and do a donation drive, and we started to really plan because that's what we were hearing from the families, and they really came back and said, don't do that. Let us do what our organization is trained to do, and let's bring it to you. And so, but I still think there's a lot around it. Basic needs are it's into mental health, of course. If the child's not fed, if they don't have a proper house, then you're going to struggle. So it's still something that we're trying to build within the community, but it was really about bringing those partners in to be able to provide those resources. Yeah.
Katman, since food insecurity is such a key part of public health, what do you see happening here, and how do communities sort of overcome some of this?
Well, I also wanted to say that even though I think the statistic was 21% is food insecure in Bexar County, there's a much larger number of people who may not be food insecure but are not getting the proper nutrition. And I've spoken with older...
We're in Texas, that number is way higher.
Yes. And so I've spoken with older populations who no longer eat meat because they can't afford meat to buy meat. So are they getting enough protein in their diet? They're buying whatever is available at the local convenience store because that's the only thing that's available to them. So I think when we talk about food insecurity, we also have to talk about access to healthy food and affordability of food, because that's not necessarily addressed even if we lower food insecurity for many families. In terms of, what was the question again?
Food insecurity, just in
Food
general.
insecurity in general.
Yeah.
Yeah, I think whether we're talking about food insecurity or other resources, there are significant deserts, both in Bexar County but across the state.
Yeah.
And I see many services in our county that are either north or central, some on the west side, but significant gaps on the west side and the east side and the south side. And so that's not acceptable. It's really not acceptable. So investing in those areas, but also thinking about food from a larger perspective or lens can really help us address those issues. So in Austin, there was a project that was a partnership with Meals on Wheels. And during the pandemic, the delivery folks for Meals on Wheels could not have contact with the older adults that they were serving. So they implemented a very simple strategy, which was to call each one of these homes for 5 minutes once a week, check in on how are you doing, who have you talked to from your family, what are you looking forward to this week? And that 5-minute call is part of a randomized controlled trial. It's associated with lower rates of depression and isolation. So something as simple as that, where we're addressing food access, but we're also looking at the larger concept of really thinking about these issues as interconnected is important.
I want to ask one more question to go around, but do we have questions from the audience? We do have some. Okay, so let me do this one, and then we'll come back to you, Mary and Nadia. And PK, and I'm going to ask everyone this one. I'm going to start with you, PK. We've asked this at the end of every panel the last couple of years, but if we're looking at children in San Antonio and in Texas, and if we had to invest in one area, where would you put that investment? And you can do one or two if you want to include mental health, because that's your area, and you guys can do that with each of your areas. But where would you say, we're not doing enough here? I think we should focus here just a little bit more.
Well, that given, certainly mental health is one of those areas of importance, but I would call it emotional well-being and looking at ways to help families to prevent loneliness, by looking at ways to keep those relationships going. But the biggest thing that I'm seeing in particular is the out-of-school time. I think there are areas on out-of-school time where children are latchkey kids, or they're having challenges. Maybe they're living with a grandparent or something, but they have very little time to connect with other children and be a part of healthy activities, where they have a good mentor that can show them the issues they're having struggle with homework, or they're doing things they can learn some kind of new activity. Those are things that I think that we're not investing in, I think, as far as helping children and having them have that good interaction in safe environments.
It's interesting you mentioned that. I was talking, it's been some time now, to a sheriff of a big urban county, and he had risen through the ranks, and he had been the head of a gang task force. And he would talk about that all the time. He said, if we had more after school, out of school time activities, and he really basically talked about, idle hands, and which was sort of interesting.
Yeah, even from a healthy sexuality standpoint, when you talk about teen pregnancy, those kind of things, it's usually that period of time where kids are not able to have healthy activities. Maybe they're not in after school, football practice or things like that, but they have nothing to do, and they're just trying to get along, and they're in places that are unsafe.
And Texas cities are some of the leaders in teenage pregnancy, you mentioned that. So, Carmen, where would you invest?
I would invest in place-based initiatives. And because I found that when you concentrate your efforts in one zip code or one neighborhood, but approach several conditions that you want to address holistically, that you move the needle a lot more than when you have services here, there, everywhere, but that are very specialized and are disconnected from one another, and people have multiple needs at once, and we can't just decompartmentalize what we're going to work on, because then we're moving the needle very slowly. So really investing at a large scale in place-based models, I think, is something.
And it's actually a philanthropic trend. You're going to hear more about this. There are a number of philanthropies that are saying, we're going to do everything in this. And, for the rest of us that are getting some of the money, they're saying, no, we're taking away, we're doing this place-based. But it's sort of an interesting thing, right? Just focus on one place. It makes a big difference.
And you're able to involve the community more intentionally from the beginning and throughout, which is really important. Often initiatives fail because they didn't include community voices from the beginning, and it could be a really important initiative and with a lot of data behind it. But often, having good data is really important in terms of informing interventions. But much of this data, communities already know about. It resonates with their experience. They've known these issues, and so involving the community alongside can really get us a long way.
Yeah, very good. Good. Monica, how about you? Where would you invest?
Well, I'd say place-based organizations, considering I work for one. Just to add, because I think she covered it, was if you're working with the community, you're going deeper on what the root cause of that community is. I also think zip codes should not place the hinder on children receiving the same services. If you go to another zip code, like where Bachman Lake is, we're actually next to one of the most predominantly affluent areas in the community, but we don't have the resources, and we're 2 streets over. And so the resources that they have for their children should still be the same resources that we have for ours, which is after-school programming, mental health services, pre-K, and all of those are readily available, but yet 2 streets over, we don't have those. So I just think, and then of course, what she mentioned about community, you just, you can have all the data in the world, but if that's not really what they need, then you're providing the wrong resource.
Monica's also near a neighborhood where it's the only school district in the state of Texas that does not accept the U.S. Department of Agriculture money for free school lunches or breakfast because they'll pay for it themselves. So it's sort of an interesting thing. Monica, I think it was 2 years ago when we asked the 5 panelists, all 5 of them said early education. So interesting. So, all right, Alfonso, how about you? What would you invest?
I think something that we can do more of and we can invest more in is adopting a population health approach. Right?
Explain what that is.
Population, one example that myself and my students, a very small example, is we're going into the community to deliver evidence-based, culturally adapted interventions. For example, we're partnering with the Far San Juan Alamo School District in the Valley, and my students and I go to the schools and we're with the students, at-risk students, at this program called Buell High School in FAR. And these are students that are involved in the school system have exhausted most of their resources. They're on probation. Many of them come from colonias, single-parent family environments, and they're in this school that's very innovative, highlights sustainability in their curriculum in this program. And we have those students 1 period a day providing a culturally adapted dialectical behavioral therapy program. So they're receiving DBT from a psychologist and psychology trainees in the schools, and they get credit for the social and emotional well-being of the Texas education system. Right, so that is one way, one example of how we can do that. Thank you.
It's not even an applause for you.
I know, thank you guys. But that is one example, because we're in the community, right? And we're living with them, we're eating with them, right? We need to go to school with them, come in, because that is when, they're given that opportunity to be provided with the services that they're direly needed.
You're starting to speak like the Valley too, which is putting the comments. It's very nice. Julie, how about yourself?
As a pediatrician, my role is often to be the person in the room advocating for the child in overall interventions. But I think the other way around, when we're thinking about interventions for children, is to ensure that we're focusing on family units as well. It's very hard to have educational, nutritional, mental health interventions without thinking about the child's hyper-local environment, and really thinking about how we can help when we're investing in children's health and investing in the family as a whole, because none of them are in isolation, and so much of what we can do to help children thrive is also helping their families thrive. So I think that that's one of the biggest things, is making sure we're not thinking of the child's interventions for children in isolation, thinking how we're really uplifting the family as a whole.
I want to ask you one more question, Julia, because we brought you in from New Haven, right? So all the way from Yale. I was in Barcelona not long ago, and when someone said, "Where are you from?" I said, "Soy de Texas," and they rolled their eyes a little bit, right? And so I wonder, you're up in New Haven, Connecticut, and I know that you guys roll your eyes a lot. You don't, but others might roll their eyes. But obviously, when we asked you to come down here, you probably started thinking, well, what's going on? That's really interesting down there, because there's a lot of great stuff happening here. And what was sort of the stuff that excited you about what was happening in Texas that you thought, wow, I can't roll my eyes because it's too good?
Well, I'm very fortunate to have had connections with incredible physicians, providers, community organizations within Texas over the years, and it's honestly inspired a lot of the work that I currently do. When I was a resident, I had the opportunity to go to UTRGV and work with Dr. Marcia Griffin.
I'm collaborating with, and that was our
She's fantastic.
And it was from her. It was on the ground education of sitting and listening to community organizations and realizing how much we need to look within our community to try to see where the needs are and respond in the moment. So honestly, it's an honor to be here because I have learned so much from everyone in Texas. And, you know, I also am from a state where there are resources and state-based support for a lot of the things that so many organizations are doing really on their own here. So it's just incredible, it's inspiring, and it's an honor to be here.
Very good. All right, I'm going to take your mic and I'm going to bring it over to Mary and Nadia so that they can ask a couple of questions from the audience. Make sure, Mary, that they're super hard-hitting and difficult questions. That would be good.
And very, very specific, yes. So I just want to say thank you all. We've got a number of wonderful questions here. We're not going to be able to answer all of them in this time. One important question that came up several times is, yes, slides will be sent to those who provided their email during your registration. And then if you have some specific questions that aren't answered, you've got the contact information, QR code that you can also reach out to, and we'll do some specific follow-up. But just to go through a couple of questions for the audience, for our panelists from the audience, I'm going to combine a couple too to help here. One couple of questions are, how do you gain community buy-in? Dr. Valdez talked about that a little bit, but the flip side of that also is what are some of the best ways to bring community leaders together to create those connections that we need? That also ties into some of that cross-sector collaboration. So how do you gain community buy-in, and what are ways to bring community leaders together to create these connections? Who would like to go first?
Comment and then Monica. We'll just do you two for another question.
Yes, great question. So I think to get community buy-in, it's not enough to come to the community and say, we want to know what you care about, and then we do the work. What has been really helpful to me in my work is coalition building, so that the community is at the table addressing the issues themselves. And what we're doing is we're leveraging the relationships we have with other partners to bring them together so that they can work together, but being very intentional about who's at the table. And also, just because multiple people have an interest doesn't mean that they have had good relationships in the past. So keeping that in mind and doing the necessary work ahead of time to make sure that not only do they have the same interests, but are willing to work together. And so that's very important. And then I actually do work in the RGB, so very close to Alfonso. And we have 3 coalitions, one focused on heat and mental health, one focused on youth and the environment, and then a youth coalition. And what we found is having the community and the grassroots organizations bring the people, because they have the local knowledge and the experience, but then also bringing in the policymakers. So we have in our coalition on youth and the environment, we have people from the city of FAR, from Parks and Recreation, from local hospitals, and we have grassroots organizations, parents, school districts, and that's how then you're able to bring people together by showing that you need both those who can make the investments, but those who have the lived experience working together to make it.
Monica, very briefly.
Yeah, so the only thing I would add is the intentional model that organizations bring. So we have community members that are on our coalitions, as she mentioned, but we also have them on the board. And so they're through different levels of our organization, so it really shows they're making these decisions with us, which is very different than just bringing them in to have a focus group. So.
Yeah, very good. All right, Mary, have another hard-hitting one.
All right, so here is, what are some ways that you can recommend to support encouraging families to attain resources, particularly when they're undocumented, but also even mixed documented status? And we also know even those that are here with green cards are also afraid to get missed messages as well. And then, the next question, which we can't do, is how can we guarantee that they can obtain resources safely without fear of deportation? Well, we know that we can't guarantee, but what are some of the ways we can support and encourage and give messages to these families?
How about Alfonso and then Julia?
Yeah, one thing that my colleagues and I have been doing throughout the years is, developing a hub. Right? We have the Latin Immigrant Health Alliance, LIHA. It's a website where we've collected different resources that the immigrant and undocumented population would benefit from. Providing these, resources, knowing the communities, again, going to that community partnership importance, and also working with leading nonprofit organizations. For many years, my colleagues and I have worked with United We Dream, the leading organization for DACA recipients in Washington, D.C. Right, so we've worked with them. We've worked on the mental health directory with my colleagues and I, provide pro bono mental health services for the DACA recipients that are in need, and their leaders, because they're the ones that are also going through raw right now. So working and partnering with these leading organizations and providing that hub for mental health treatment and services has worked so far.
Julia?
I think that we are seeing a constant and evolving shift in where the fear is in terms of accessing services for which people are eligible and making sure that there's reliable and helpful information. And so this is something that we're constantly looking towards our community for where there are things where we can be helpful in providing information. So often that's with trusted messengers. So the Connecticut Students for a Dream chapter is really on the ground and providing for your rights information and can often answer questions from trusted messengers who are from the community and part of the community, and constantly compiling resources that we can share with each other is one helpful way that we can approach trying to make sure that people who are eligible for services receive services. And then stepping back again, that idea of prevention and kind of universal provision of resources where we can, we're seeing that more and more. So our state is at least trying right now. It's in the legislative process to have things like universal meals, and our health clinics are now providing a universal food prescription where you can just walk over and get food, and there's kind of a no questions asked. There's no need to screen. It's just there and it's available. So where we can to provide those resources without any barriers, and where there's a need for information, trying our best to understand who the trusted messengers are in the moment. It's very evolving.
But Connecticut's almost a socialist state, isn't it? And we did. I wanted to ask you, because El Paso is sort of a smaller community, does this resonate in El Paso as well, or is it a little different?
Oh, it does. And one of the things that I wanted to mention is that we don't talk enough about the philanthropy, but when we try to get key leaders together, a philanthropic organization, somebody like a foundation, they have a lot of influence on pressing a group to come together on specific topics, I would say. And I know this community has some foundations, and they probably do that. So just throwing that out there. But on the side of that, with El Paso, if you drew a circle around it, the Paso Norte region includes Ciudad Juárez and the southern New Mexico counties of Doña, Luna, and Otero. And then we also include El Paso and Hudspeth in that region. So if you drew a circle around there, you drove in about 250 miles in each direction, you can find one major city. So we have to work together. And there's a lot of people that come up northern Mexico to come into the United States migrating. You probably have seen El Paso's videos of El Paso on there where people were coming into the United States.
Yeah.
And the challenges that these organizations have faced is overwhelming, but their resolve is great. I mean, we help everyone. We're not going to ask questions, even when there's things there's time for people that haven't asked questions. They find ways. We have our United Way or different funding sources that may provide funds for people to get services, whether they have no means of service, and we're not going to ask them for this. Our federally qualified health centers have been really tremendous at that in our community. Right now they're being challenged, but our other community organizations have come to their defense and saying, we want to help and make sure that if there's something missing, we're going to try and get it to them.
I always love to tell people El Paso is closer to Los Angeles than it is to Houston. It's just, it's sort of it's far away. And I always find every time I go to El Paso, people are really excited to see me. It's like, oh, you care about us way out here. It's really nice. One more quick question, Mary.
One last question here, and so this could apply to a couple of our panelists. Oftentimes, people go to their faith-based organizations, churches, temples, synagogues, for support. They are trust-based there, and they have confidence. They'll go there even for wellness and support. So how can organizations better partner with the faith-based communities in terms of addressing wellness needs? And as somebody else's question kind of ties into this, using vaccinations as an example. Do we vaccinate? Do we not vaccinate? Some of that has been playing out in the faith-based community. So what concerns do we see down the road in terms of wellness using that faith-based lens?
Wow, that's yeah. All right, Julia, since you're out of state and you have no political damage here for you, what do you make of this?
I think this is a really important and critical observation of knowing where there's trust in the community, and faith-based organizations are a huge part of that. At our university, there is an established kind of community advisory board that that has a consistent presence from leaders from many of the religious organizations within the local community, and there are people who are interested in doing community-based research go to. Think about how they're going to design their study, have outreach, and build trust. So being able to establish that and making sure that we're bringing faith leaders to the table for these conversations is a really critical aspect.
I want to get to the second part because you are a medical doctor, and vaccinations are so important for kids. I mean, and you're at the American Pediatric Society, and so you guys are talking about this a lot. And how does that sort of impact our communities when there's significant groups? And I think personally, there's small groups of people that don't like vaccines, and I just hope they stay healthy. But when you sort of stop saying it's not mandatory anymore, there's another whole group of people that are just busy working and they don't have enough time. And if the government says I don't have to get vaccinated, I really need to work. So what do you got? As a pediatrician, how do you address that?
This idea of bringing services, especially for prevention, especially for vaccination to where families are, can be really critical. So during the pandemic, that's exactly what we did. We partnered with a lot of faith-based organizations as well as local community organizations and had a van and brought vaccines to wherever families were when they were not coming into the pediatrician's office because that was a pandemic. I think that absolutely is an opportunity now as well in terms of multiple lowering our barriers. Sorry about that. Lowering our barriers to all of the things. So when it's not a vaccine hesitancy problem, it's just I'm busy and it's an access problem. Absolutely. The other thing that can be helpful is when it's required for schools, which it relatively recently is in our state. So that can also be helpful.
Carmen, I think on partnerships, the faith-based community can be a great partner, though, for us, right? And sometimes, I remember one time we used to have children, we used to have a Pray for Our Children week, which was the week before. And it was basically, that kids go to school and, a lot of the sort of normal things. And we had one church that said, well, can we pray for our unborn kids? Would this be part of it? And we had to stand up, and basically another pastor said, listen, let's not be political. Sometimes, though, with the faith-based community, maybe another faith-based person has to stand up to it. But talk a little bit about sort of and this will be our final question, final answer, but in terms of those partnerships, talk about that a little bit.
Yeah, that's a really interesting question because our communities definitely have groups that are very spiritually focused, and the church has been a source of respite, and also a source of services and resources that otherwise wouldn't be available in the community. On the other hand, I'm also seeing a lot of communities leaving traditional Catholic Church because for a very long time, the Catholic Church was focused on doctrine and teaching that, and it just wasn't resonating with people's lives. And so I'm seeing a lot of Hispanic communities gravitate towards different denominations and even outside of Christianity. So that's interesting. I'm curious how that's going to change now that we have a hope that's much more, a attuned and more connected to the day-to-day lives of people.
An American.
And American, speaks multiple languages, and seems to be an ally. So there could be change there, and I think people are looking for that type of leadership. So this is an opportunity for the church to really take a stand and to offer resources that people need on a day-to-day basis.
Very good. Julia, Alfonso, Monica, Carmen, Enrique, muchísimas gracias. Thank you guys very, very much. A big hand for them. All right, so Mary wanted to go on for another half an hour with closing comments, but I said, no, absolutely not. I'm going to go on for half an hour now. I really want to thank the team at Family Service for the great job they did in helping us put this together. I want to thank you guys. And man, San Antonio is such a great place. So many things to be happening here, and I love coming here. But the important thing, we're optimistic. We know there's things to do, but there's work to be done, that's for sure. Mary, final thoughts?
Absolutely. First, I have to make sure, please, scan the QR code. We'd love to get your feedback because we have committed we're going to do this again next year. Y'all want to see us again next year to do this? All right, thank you, because we want to keep getting these messages out. Too, I want to thank Dr. Bob Sanborn and his team, great partnership, all this data. The data informs our work. We've got to make sure we understand it and articulate it. But at the end of the day, it's still all about the people. I want to thank our panelists for their expertise and everything that they bring to highlight and show, what we do. I do want to give a shout out to the Family Service team because they've been working so hard on this for all this. And most importantly, I want to thank all of you in this room because you are here, you are present. You care, you want to be in this room. And this is so important. You heard just little pieces of it today, and you all live and work this. You all live this every day with those that you're serving. And we can't keep doing what we've always done. We can't just keep settling in mediocrity. We absolutely have to figure out how we can better collaborate, how we can better understand, how to make sure, and Dr. Valdez said it too, is who needs to be sitting at these tables? We don't need somebody outside trying to quote unquote define a problem and then tell us how to fix it. Things don't get done that way. The ones who know the problems live in those problems. They have to be at the table. They have to be part of that discussion. They have to help define that and then work together, but they don't always know what opportunities and options are out there for solutions. And that's where that collaboration comes in. The funders, good-hearted folks, are how do we make sure they understand what the real needs are, and how can we stretch, we don't have pennies anymore, how do we stretch those nickels to make sure that they are able to accomplish things so we can make real intergenerational change and improve in the lives of children, families, and communities. Because if a child's growing up in a dysfunctional, chaotic, unstable home environment in their family, and if that family's living in a toxic neighborhood and community, everyone is struggling. And that doesn't matter if you're living in our most affluent neighborhoods, we know where they are here, or if you're living in our most impoverished ones. Everyone is affected directly or indirectly. So we want everybody to have the opportunity to live in thriving, healing, strong, vibrant, healthy communities, which means we need to have them help to develop strong, thriving, healthy families to raise strong, healthy, thriving children who will become that next generation of adults to be the leaders in our community. So thank you all so much for that. Give us your feedback so we know where to focus next year. Again, another round of applause to our panelists who came from all over the state and all over the waiting for snow and all that to come out here. And so if you want to stay around, we've got time for one-on-one discussions as we work to pack up and clean up and enjoy the rest of your day. Thank you all so very much.
Thank you guys. Safe drive home.